Your heart beats over 100,000 times daily, without rest. But when was the last time you checked its health? Heart disease is the leading cause of death worldwide, yet most cases are preventable. Early detection through key medical tests can identify risks, enabling timely lifestyle changes and treatment. Every 34 seconds, someone dies from heart disease. It's a global crisis with rising numbers, but awareness and regular screenings can change this. Prevention is always better than cure. Beyond lives lost, heart disease imposes a massive financial burden on families and healthcare systems. Early intervention not only saves lives but also reduces costs. Take action today. Protect your heart. The silent epidemic of cardiovascular disease. Heart disease doesn't always announce itself with symptoms. It often develops silently over years, only revealing itself when it's too late. That's why regular screenings are crucial, even if you feel fine. Many people with heart disease don't experience symptoms until a heart attack or stroke strikes. That's why proactive testing is essential. The sooner you detect an issue, the better your chances of preventing a major health crisis. Too often, heart disease is diagnosed only after a serious event, like a heart attack. But by then, damage has already been done. Don't wait for a wake-up call. Regular checkups and early testing can help prevent irreversible harm. Your daily choices, what you eat, how active you are, and how you manage stress, all shape your heart health. Understanding your risk factors and making positive changes now can significantly reduce your chances of heart disease. Heart health. Awareness. Protecting your heart starts with knowing its risks: smoking, obesity, high blood pressure, and diabetes. The good news? Many are manageable. Smoking damages arteries and raises heart attack risk. Quitting is the best step for your heart. Excess belly fat strains your heart, raising cholesterol and diabetes risk. Small lifestyle changes help. High blood sugar damages blood vessels, increasing heart disease risk. Managing it is crucial. Genetics versus lifestyle. Genes affect heart disease risk, but lifestyle choices have a greater impact. If heart disease runs in your family, regular checkups are key. Healthy eating, exercise, and stress management protect your heart. A family history is a signal, not a sentence. Prevention is in your hands. Heart health screening. Screenings detect risks early, preventing serious heart problems. Tests include cholesterol, blood pressure, and blood sugar for a full heart health picture. Early detection allows heart conditions to be managed or even reversed. Screening results help doctors tailor prevention and treatment plans. Importance of early detection. Early detection can prevent heart attacks and save lives. Knowing risks early gives you time to make changes and seek treatment. Prevention is easier and more effective than treatment. Catch heart disease early for better treatment, smoother recovery, and longer life. Your heart health is in your hands. Act today for a healthier tomorrow. To assess heart health, doctors use several key tests that detect risks early and guide preventive care. These include cholesterol and blood pressure checks, heart rhythm assessments, inflammation markers, and imaging scans. Let's explore each, starting with the Comprehensive Lipid Panel. Test 1. Comprehensive Lipid Panel. Your cholesterol levels play a major role in heart disease risk. A comprehensive lipid panel measures different types of cholesterol and triglycerides, helping you and your doctor understand your heart health better. Understanding cholesterol levels. Not all cholesterol is bad. Your body needs some cholesterol to function, but too much of the wrong kind can clog arteries. Knowing your cholesterol numbers helps you make informed choices about your diet and lifestyle. High cholesterol can lead to plaque buildup in your arteries, making them narrow and increasing your risk of heart attacks and strokes. Managing cholesterol levels is crucial for keeping your arteries clear and your heart strong. Cholesterol levels aren't just about genetics. They're also influenced by what you eat, how active you are, and other lifestyle factors. The right food choices and regular exercise can help you maintain healthy cholesterol levels. Good versus bad cholesterol. Explained. There's good cholesterol, or HDL, and bad cholesterol, or LDL. HDL helps clear excess cholesterol from your blood, while LDL contributes to artery blockage. The goal is to increase HDL and lower LDL through diet, exercise, and healthy habits. Test 2. Blood pressure. Measurement. High blood pressure, or hypertension, is a silent killer. It puts extra strain on your heart and blood vessels, increasing the risk of heart attacks and strokes. Regular blood pressure checks help catch problems early. Silent killer. Hypertension risks. You may feel perfectly fine and still have dangerously high blood pressure. It slowly damages your arteries, heart, and kidneys over time. That's why regular monitoring is essential. Don't wait for symptoms to appear. How blood pressure impacts heart health. High blood pressure forces your heart to work harder than it should. Over time, this extra strain can lead to heart failure, kidney disease, and strokes. Keeping your blood pressure in a healthy range is one of the best things you can do for your heart. Test 3. Electrocardiogram, or ECG, or EKG. Your heart has an electrical system that controls its rhythm and beats. An ECG is a simple, painless test that records your heart's electrical activity, helping detect irregular heartbeats, heart attacks, or other heart problems. An ECG gives doctors a detailed look at how your heart beats. It can reveal abnormalities like skipped beats, heart blockages, or signs of past heart attacks, critical insights for keeping your heart healthy. An ECG can detect conditions like arrhythmias or irregular heartbeats, reduced blood flow, and even evidence of a previous heart attack. If you ever experience dizziness, chest pain, or palpitations, an ECG could provide the answers. Test 4. High sensitivity. C-reactive protein, or hsCRP. Inflammation plays a hidden role in heart disease. The hsCRP test measures inflammation levels in your body, which can indicate a higher risk of heart attacks, even if your cholesterol levels seem normal. Inflammation and heart disease. Connection. Chronic inflammation damages blood vessels and makes it easier for cholesterol to build up in arteries. By detecting inflammation early, you can take steps to lower your risk through lifestyle changes, medication, or both. Understanding inflammatory markers. hsCRP is just one of several inflammatory markers that doctors check. If your levels are high, it could signal underlying risks that need attention, like stress, poor diet, or hidden infections. Test 5. Hemoglobin. A1C. Your blood sugar levels don't just affect diabetes, they also impact your heart. The A1C test provides a 3-month average of your blood sugar, helping detect diabetes and prediabetes, both of which increase heart disease risk. Diabetes and cardiovascular. Health. People with diabetes are twice as likely to develop heart disease. High blood sugar damages arteries over time, making them more prone to blockages. Keeping blood sugar under control is essential for protecting your heart. Blood sugar's impact on heart function. Uncontrolled blood sugar leads to inflammation, increases bad cholesterol, and raises blood pressure, creating the perfect storm for heart disease. Regular monitoring and a healthy lifestyle can keep these risks in check. Test 6. Stress test. A stress test evaluates how well your heart functions when it's working hard. By monitoring your heart's response to exercise, doctors can detect hidden blockages or conditions that might not show up when you're at rest. Physical exertion and heart performance. During a stress test, you'll walk or run on a treadmill while your heart is monitored. This helps doctors understand how your heart handles activity and whether it's getting enough oxygen. Types of stress tests. There are different types of stress tests, including treadmill tests, nuclear stress tests, which use imaging, and pharmacological tests for people who can't exercise. Your doctor will recommend the best one for you. Test 7. Echocardiography. An echocardiogram is an ultrasound of your heart. It provides real-time images of your heart's chambers, valves, and blood flow, helping detect structural problems like valve disorders or heart failure. The technology behind echocardiograms. Echocardiograms use ultrasound waves to create detailed images of your heart in motion. Doppler technology adds another layer by showing how blood flows through your heart, helping detect blockages or valve issues. Interpreting echocardiography. Results. Doctors analyze echocardiograms to check your heart's size, function, and blood flow. This test can reveal heart muscle weakness, valve problems, and other conditions before they become life-threatening. When and why you should consider an echocardiogram. If you experience chest pain, irregular heartbeats, or shortness of breath, an echocardiogram can provide crucial insights. Even if you have no symptoms, your doctor may recommend one if you have risk factors for heart disease. Test 8. Coronary calcium scan. A coronary calcium scan is a special type of CT scan that detects calcium buildup in your arteries. The more calcium present, the higher your risk of a heart attack. This test provides a snapshot of your heart's long-term health. Detecting arterial plaque buildup. Plaque buildup in your arteries can go unnoticed for years. A coronary calcium scan helps identify early warning signs, allowing you to take preventive steps before a heart attack occurs. Interpreting calcium score. Results. Your calcium score tells you how much plaque has built up in your arteries. A score of 0 means no detectable plaque, while higher scores indicate an increased risk of heart disease. Your doctor can use this score to tailor your treatment plan. Test 9. Homocysteine level. Test. Homocysteine is an amino acid that, when elevated, may increase the risk of heart disease. This test helps identify hidden risks and can guide dietary or supplement recommendations. Amino acids and heart disease. Risk. High homocysteine levels can contribute to artery damage, blood clots, and inflammation, all of which raise the risk of heart disease. Managing these levels through diet and lifestyle changes can help protect your heart. Ankle brachial index, or ABI. The ankle brachial index test compares blood pressure in your ankles and arms to assess circulation. A low ABI score can indicate peripheral artery disease, which increases the risk of heart attack and stroke. Peripheral artery disease screening. PAD occurs when plaque buildup narrows the arteries in your legs, leading to pain, slow-healing wounds, and even amputation in severe cases. An ABI test helps catch this condition early. Blood flow and cardiovascular health. Good circulation is essential for delivering oxygen and nutrients throughout your body. Poor circulation can lead to complications like tissue damage, chronic pain, and an increased risk of cardiovascular disease. Interpreting test results. Numbers on a test report can be confusing, but they hold valuable insights. Work with your doctor to understand what your results mean and how they impact your overall heart health. Additional test. Advanced lipid testing. Beyond standard cholesterol tests, advanced lipid testing provides a deeper look at the size and number of cholesterol particles. This can help identify hidden risks that traditional tests might miss. Traditional cholesterol tests measure total cholesterol, LDL, and HDL. Advanced testing examines LDL particle size and number, as smaller, denser LDL particles are more likely to contribute to plaque buildup. When to consult a cardiologist. If you have abnormal test results, a strong family history of heart disease, or symptoms like chest pain or palpitations, it's time to see a cardiologist. Early consultation can help prevent serious heart conditions. Understanding your personal risk profile. Assess your heart disease risk by considering factors like smoking, obesity, high blood pressure, diabetes, and family history. Knowing your risk is the first step toward prevention. Lifestyle modifications for heart health. Your heart health is in your hands. Regular exercise, a heart-healthy diet, stress management, and quitting smoking can significantly reduce your risk of heart disease. Small changes lead to big results. Taking care of your heart today means a healthier, longer life. Thank you for joining this session. Now take what you've learned and put it into action. Your heart deserves it.